to further probe those numbers that you gave us before, you said 134 kids have been put into hospital, most of them for social reasons. Can you tell us how many for social reasons? And Minister Hunt, the government's been writing to the over 60s who haven't been vaxxed. Have you worked out why they're not, why they haven't taken a dose, hesitancy, waiting for Pfizer or whatever? Have you thought of asking GPs, perhaps offering some money as an incentive to get them to vax patients that they know are not vaccinated?
You go first, Paul.
So in terms of the numbers, I don't have the exact number for you, Andrew, sorry about that, but the NCIRS, actually Professor Bowie is part of that research institute in New South Wales, has looked into this in some detail. So if you were looking for actual numbers, you could probably refer that question to them.
And the answer is yes, GPs receive approximately $65 for every double dose vaccination they provide to a resident. They've done an amazing job. It's our GPs that have done the vast bulk of vaccinations generally, but in particular, they have provided the vast bulk of vaccinations for the over 60s. And every day we're seeing those numbers continue to increase in the over 60s by 0.3, 0.4% on a daily basis. And we're now at 84% for over 60s, 88% for over 70s.
Unvaccinated. This is why you're sending out letters. What are you doing? It does, go for it.
We're reaching out in multiple ways. Our general practice is the front line, contacting over 60s ourselves through local campaigns, all of these things. It's actually working. To think of it this way, almost 80% in the next 24 hours of over 50s vaccinated, 84% of over 60s, 88% of over 70s. These are phenomenal rates, but we're just going to keep driving because we want every single person, unless they've got a medical reason not to be vaccinated, to come forward. So we'll keep going on that front. Greg?
Mr Hunt, when do you expect that under 12s will be one day directly involved in the vaccination program, and what sort of time frame are we looking at to consider that? And secondly, given what's happening out of Western Australia and Queensland, do you concede that the national plan, the 4-stage plan, is under considerable doubt?
No. Look, I understand there's debate. Federation has been with us throughout the life of our nation, and debate and federation are exactly the same thing. They're part of it. What we actually see is that we are heading towards a nation that will progressively open up. Those 80% marks, I think it will be very, very hard for anybody to be separating, as we heard with the case of this beautiful 3-year-old, or cancer patients, or separating grandparents from children for weddings, for funerals, for the great events of life, for births. Those deepest, most profound of human engagements, as well as all of the elements of commerce, of making sure that the contract harvesters are there for the wheat yields and for the wheat crops in Western Australia, and people who are picking fruit, the seasonal workers, all of these things that make up the nation, they will provide the inevitable pressures that mean ultimately, we will be able to move again as a country. And I understand that there will be debate along the way, but we have the strong support of the nation for the partnership that was agreed between the premiers and chief ministers and the Australian people and their own residents, that we work towards this national plan.